So I am a researcher in health and a specialist in patient engagement in research. I work at the University of Moncton and through the New Brunswick Training Center. Now, you know that every day we work quite hard to serve our people. So we want to improve things by improving decision making as well as our knowledge. But how do we assess these? Well, today I'm going to talk about the challenge of doing research in general and with certain populations. I'll talk about the importance of renewing things, of going out of our comfort zone. And before going into that, I want to explain how I came to be a specialist in patient engagement, and especially why. Now let's take a look in the back. When I was in my doctorate studies, of I wanted to see. I was looking at certain types of molecules that were quite toxic, and I was using standardized and aseptic examples. So I was comparing the healthy cells with the cancerous cells, and I tried to see if there were more deaths among the cancerous cells or the healthy ones. And we could be very, if there was less than 30% of those of the if less than 30% of all the cells died due to our chemical treatment, then we could be fine. And so certainly we use the type of chemotherapy that used quite a bit, but still these were very interesting results. So I tried to get to hit the most cancerous cells possible, and I would try different types of molecules, and I saw that we were trying to find what was happening with the cell, and eventually I found a default in the physiology of all. There was one molecule that could find in all the cancerous cells, and it worked quite well. I even got a patent in Europe for this, and that article dates to 2011, and there have been at least three. It's been cited at least 3 times every year. So we kept trying to find a molecule that could kill cancer, and then after my doctorate, the 3 members of my family died of 3 different types of cancer, and they wound up having been treated with the same type of chemotherapy, and they died all within 9 months. My brother-in-law died without any reaction to chemotherapy. My father was 64 when he died, but he had been cured through chemotherapy, and the outlook was pretty good at first. But then he had a sudden relapse, and it was the same chemotherapy that had saved him. All of a sudden, it didn't hit him. It didn't save him the second time, and he died 3 times after the relapse. And certainly, this, of course, an emotional shock could have triggered that. And my great uncle was 93, and he didn't want to fight, so he had some treatments, but all he really wanted to do was join his wife. So often the cancer cells would reproduce at a slower pace, but in his case, they reproduced very quickly. So the magic bullet, I figured, would not exist. There are many other types of factors to take care of. If we want to make a difference, I had to leave the laboratory. I had to understand the person before understanding the disease. So I became a and a research analyst with the Strategy for Patient-Oriented Research. And this had been started 10 years ago by the Canadian Research Institutes. This slogan I found was very important, patient-oriented. And that's how it started. So it was certainly hard to start with. I understood that I would have to work with people who had been working on these cells. And certainly they were all very enthusiastic with the idea. But it was just not, it wasn't just a matter of knowing how they lived through their disease, but I had to collaborate with them from beginning to end. They became co-researchers. So they don't know anything about research, the research methodology, but they still had to become associates to help me with this. And I was skeptical at first, like many people would be. I didn't understand what the patients could contribute. So I said, well, it's a new trend, and it'll probably pass us by. So why having studied all this? So finally, I decided to get involved. And of course, as they say, you have to work the middle to be able to bend it. Now, I want to work with the autism because my 6-year-old wound up being diagnosed as autistic. And he's not the same one of having all sorts of problems with the medical center. 1.5% of children will finally be this will be just diagnosed as autism, and that's autistic rather. And of course, that's why it's become very complex. And so we tried to find out a little bit more because I had a certain expertise based on the speech of a father who talked about his sisters, and he was worried about the future in their cases. And I was asking him, what happens to them when they become adult? What will happen to my son when he becomes an adult? And so we contacted a few other parents to find out a little bit more. And each time, it seems that the future is relatively negative, certainly from the beginning. And so I really want to see if I could make a difference to try to make things better for their lives. At the first, I thought I would use administrative data for this, but finally, there was no way of getting through with administrative data. We could talk about this during the question period, but really we had to work with the data. I had to get the data myself, but where would we find them? I didn't know where to turn for that. So through 2 or 3 parents who came with me, I got other stakeholders to help me to get the data and to find them as much in government studies as in scientific studies. Okay, and there didn't seem to be, and perhaps there was no. I tried to invite researchers who were working on autism, on autistic children. There weren't any that were working on autistic adults in the Maritimes. So I went to find psychologists, community organization managers, as well as people from social development and other parents of children who had become adults, so that together we could look at this research project that would allow us to find the data, but perhaps would be beneficial to all. And we tried to be optimistic too. And we had, I can tell you that I almost regretted getting into this because I'd heard all sorts of discouraging rumors. And it's important that I introduce this so that we can understand afterwards why we have to get out of this. I heard remarks from different people that they also many were resistant to collaborating with us. So how would they learn to learn a trade, for instance? But what I see is that they didn't mind collaborating with parents, and we'll get back to that a little bit later. I also heard rumors from adults, about adults as well. Why do this while uh, the the researchers are looking for a cure, as you know? We all have the same challenges, but at different levels. We are humans, and we want to live. We, so it's this wasn't at all their vision. And others said even the parents, some parents at least, don't understand it because some parents want a cure. They don't want the child to be autistic anymore. And but they'll say, "Well, I'm autistic. That's my identity." Others would say. So there were a lot of challenges when it came to communications. And when it comes to the adults, I mean, there are some people who work with them, and we heard them until the autistic people could speak for themselves. There are many people will say, my child has many more challenges, has many challenges that are way much more important than working with you, they would say. So I figured, okay. And even service providers just withdrew from the committee. Oh, well. So we decided others just want to be observers. We wish you good luck. So it was pretty hard to bring all these people together. Very hard. So finally, we can perhaps, it had to be a collaborative project with the stakeholders. And I didn't see how we were going to get this done. So I had three choices at that point. First choice, either find a way of getting everyone together, give up, and we gone. Okay, and we should say that no one is working on adult autistic people, and then finally perhaps divide the people into groups and work on the different groups, either the parents or the children or other adults. And so we want to get data that would help for decision making for these people and something that could then be applied to the entire community. So I decided to back up a bit and I decided to go do some homework. I tried to find out everything I could on all these roles, but especially to see what the motivations were and what was guiding them. And so I took the first option, and I decided to have them do some homework as well. I organized a summit and I asked them to make presentations. I invited the public, but I also had all of the stakeholders that were already involved. And we want to have all the same information based on everyone. And in the end, we were able to get information on the entire community as well. I also offered to one or two adults who were part of the first discussions to become co-managers of the project, and hoping that by spreading out the power a bit, the researchers would be able to work together, even if we had to force them a bit to start with. Finally, what we realized after the summit, and this was taking place in Shediac, is that it was the needs of others that were guiding them, not their own needs. And we were trying to do something for other people. To think that it's something, the impressions weren't quite true. And there were prejudices, there was isolation and suffering. But thanks to these summits, they saw that they all had a place in the research. Instead of competing to get the interest of for financing and research, they decided we should work together. And then I was able to work well with them. They accepted to work on the same project, but they still didn't want to get together to discuss. It took time and a lot of work to get enough confidence and trust from the different parties that I was able to get them all together in the same room. But then I can't tell you all the details, but it was fascinating. We learned a lot more during that meeting than everything that we had tried before. I'm still going to take the time to talk to you about the commitment of autistic adults. And I will be presenting some results during the presentation, but I want to especially talk about the commitment, the engagement of those who want to work with this. But first, just to make sure we understand what the project is, here's a little video that we did with one of the co-managers, and to talk about the methodology, etc. And it's on the production. Hello, I'm Louis. When I was diagnosed, I went to the kitchen chez Louis. Like at the restaurant. Okay. 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 Okay, and of course I like to go camping. Maybe I'd go to France or China. I want to be an adult. Hello. So this video was to promote the study, and I've been asked, how did this work? How did I work with them? How did this work with the partners? And it's funny that we often want to know how it was done, but we never ask why. So, I mean, what would be the value added to this? Why get the engagement from patients? So I did find a few reasons. So what was in this question? First of all, the question was improved because we were able to get a more inclusive perspective. Also, it helped to finding the methodology. At first, we had more of we had focus groups, interviews to try and to see what would happen when autistic people became adults. But that wouldn't have happened with these people because we weren't able to get enough of a sample. These were not necessarily the most adequate people for one-on-one people. So we decided to see what could be done online and what could be done in person. Then we were able to get more respondents because as trust was formed, it gave them more. They really wanted to get results and they want to see the results about themselves. So they shared as much as they could. And finally, it allowed us to add to the data because having percentages, ratios, averages, that's fine. But if there's no context for all that, it's hard to interpret them. or perhaps we'll misinterpret them, and this can hurt the people even more. So here are a few results. First of all, we saw that 84% of them did not work full time. So that was a lot of people who weren't working, and that the annual revenue was $7,500. The quarter and the quarter of the adults were living on less than $30,000 a year. So if $2,600 are spent just to get services due to their being on the autistic spectrum. And so we found that 15% of the adults weren't able to get the mental support services because when you don't work, we don't have health insurance. And 71% have at least two different health problems, and a quarter of them have anywhere from 5 to 16 comorbidities. So we did the video. We'll see another one near the end to talk about all these results. And so we made co-presentations. We had research data, and so we even after, despite everything, they never gave up. So they left their comfort level, and we presented those results in national and international conferences. And there's so we were presenting these in the worst environment, often with PhDs, etc., and they seem to be overwhelmed by everything. So if we look that way to the left, we changed the definition. So we went from being having based on the deficit to a definition on the basic needs. So because this would be one of the ways of measuring success. The researchers now, when they read it, they can feel more confident in collaborating with the autistic people. And it takes a great big barrier when it comes to but certainly many of these much of this data, much of this knowledge is hard to find outside of the immediate community. But then I started to work on something that could be shared with autistic people, others, researchers, etc. And so we worked on a video game.
The needs, and also, in fact, these are accessible. So I don't know nothing about computer coding, but here it goes. So it works. Find solutions through various exercises, but at the end, we were able to come back to the beginning, change a few things, and see how things go. This is the only way to see if we were able to get the attention of the public. So the mobilizing in fact, so the impact of this collaboration is, and in fact, how do we measure it? There are a few things. There are a few things that we can see. So there's the immediate impact of the partnership, the confidence of autistic adults and parents, enabled to have better confidence. It also includes that, yes, the fact that they have their word to say. So they've become ambassadors of the autistic community, not only about their needs, but others. And then there's a sense of belonging as well. And this before. In the past, in fact, they didn't feel that they were part of a group. And my son decided that his autistic friends, were friends for life. So I call this in general, in fact, the collateral impact of the project. But on the other side, I see a few people who say, if you can use the results of Connect. Sometimes, in fact, they deal more with one group, age group, or a local community. But this is a more direct impact, but it's still untangible because I can't measure it. And there are researchers in the Maritimes who mostly work with children. Now they mostly work with adults. So we've generated something here, even if it's not very tangible, it is still of a vital importance. And also there is a bigger impact. Connect has asked me, in fact, to provide advice to multidisciplinary teams at the national and international levels to test interventions with autistic adults, and even for subgroups, just like a project in Ontario right now, where we want to develop an intervention on elders. So this is a specific group. I'm always wondering, well, how did they find me? In fact, I've only been working on this for 3 or 4 years. But I said to myself, what can I do for them? And I realized that there are 2 reasons why they found me. Is because I've been very vocal in the media. I wanted to talk about the project as much as I could. So I believe that that helped. And also, there is a positive impact in research. And I believe that it's something very important where people come and see me to get some advice. Because I try to show honestly what are the challenges, but also that the benefits go over and beyond the risks. So they count on my expertise. So this is a personal victory, and I believe that this is very important for this community. So what are the 4 main steps that lead to a successful project? And maybe we should concentrate on the success of the partnership for Connect. So this is started from with a concerned father in Fredericton. We hear about Connect and also about autistic adults in research all over the world. So success is no longer measured by percentages, but by inclusive, equitable, but rather on smiles. No one can be left behind because it's too costly or it takes too much time. In fact, when we're in a big group like this with various perspectives, we find solutions. So this involves that we need to get out of your comfort zone, but when everything works, everyone wants to follow you. So this year, I see that the partnership, in fact, has grown. I would never imagined that it would become so big. So the first step, and now I insist on the fact that what worked in this project can work for any community or any group. So before starting a project, we need in fact, we put a little too much emphasis on beliefs. And the problems were defined, in fact, a deficiency regarding community links, and in fact there is a hereditary component as well. in fact, other than the neurological, and there are many pathological aspects and physical and mental aspects. So that's this has an impact on the clinical knowledge. And what is the impact? In fact, there is a piece of the puzzle that shows autism, just like if there were missing a piece, there was a piece missing. Many autistic adults, in fact, we see this piece of the puzzle that doesn't fit anywhere, or that there is a piece missing, or that autistic people didn't fit in society. And this had a very negative impact on these adults. So in research, we try to have groups that are the most homogeneous possible to have the best results. But in fact, some researchers concentrate on one group or have subgroups. And in autism, these subgroups, in fact, there were arbitrary points that were considered about the physical aspects, mental aspects. So we have the spectrum of autism here. People who work or are high functioning, those who have severe autism at the other end. And we have to remember that the data comes from data regarding children. So the intervention that were made were about cognitive aspects and behavioral aspects. It doesn't say, in fact, what will work for adults. So we put the emphasis on autistic symptoms, but this never provided in fact, no biomarkers of autism. So there's no magic bullet there either. But often researchers, in fact, can remain stubborn. There can be very different challenges depending on their age. And maybe, in fact, they don't necessarily want to learn how to behave in social settings. I believe that autistic adults prefer to be accepted as they are. So I could have done the same thing if I only relied on the scientific data. What I understood in this project is that the chronic conditions have a direct impact on autistic people. First on regarding behavior, and also the difficulties in the everyday life. And these chronic conditions, unfortunately, are often ignored. We don't necessarily consider them in research projects regarding autism. It is the partners, in fact, that put the emphasis on this. So these are experiential knowledge that goes over and beyond. In fact, they complete the scientific knowledge. So we need to better understand population and listen to them just as much as we listen to our scientific colleagues, and put the emphasis on the nuances that bring them together. And after that, we can act, in fact, bring together all the various parties. And remember, at the beginning, we were able to bring researchers and adults together. There were also the service providers that took part. And the noise that I made, I was able to, in fact, to be able to attract the public. And I'm trying to convince the last group now, those who make decisions. The Department of Social Development is involved since the beginning as observers, but it's not sufficient. Not only, in fact, young children need you, in fact. there is an incredible work that has been done for young people from 2 to 5, and that was recognized internationally. And I believe that children, in fact, benefit from many services that are provided by the Department of Health. My son, at 18 years old, in fact, autism is not the responsibility anymore for the Department of Health, but the Department of Social Development. But their state is fragile, and we need a multi-jurisdictional approach. Someone who's autistic, who's 20, can have as much comorbidity as an adult of 80. Yeah. In fact, the suicide rate is much higher. So here are some results. To be able to make a decision, we need to have all the right cards in place. And this project helps to provide cards to all the players. Other than the data that we provide, I hope that we can put the emphasis on the direct impact in the research project itself. So to come back to the 4 steps, I had to put aside, in fact, we need to work closely with the community so the community is heard. And Pico has mentioned that transformation happens when I'm not in charge. So we need to be able to learn to let go and let others who know this topic take the lead. It doesn't mean that we can't help. No, we can help as researchers that help us to go all the way and bring all together the experiential knowledge. So we'll still have researchers who will try to find a cure for autism. That's how it is. Fundamental research put the emphasis on the causes of diseases. I would say that if one considers autism as an illness, this will continue to harm the autistic community. So this is why I will continue to share knowledge with autistic adults and also the results that we find. So this enables us to redefine autism. And for the adults who are involved in this project, it enables them to show their identity and to be able to promote the being accepted. And this notion, in fact, and it asked me to make that I went over and beyond what I knew. And if this, maybe this could explain various problems. So I put the emphasis on health and on needs. And instead of having percentages and figures that don't necessarily provide a lot of information, I tried to provide models by putting the emphasis on comorbidity rather than putting the emphasis on the challenges regarding autism. And I found 6 interesting profiles, and the results have not been published yet. We're preparing the article. There are 3 important results here. First of all, you have to know that women have a tendency to have more comorbidity than men. 47% had more than 5 chronic diseases. And in fact, this has a big impact on the autistic community as a whole. 1 among 4 are women. And in the model that we have here, we have these 6 distinct profiles. There are 39% who are in a class that we call fairly good health. So all the conditions, in fact, compared to the rest of the sample. This doesn't mean that they're necessarily in very good health. But let's say that for the group that we had, the sample that we had, those who had fewer comorbidities were in this class. And in this category, 16% approximately, the anxiety disorders without any other implications. So this is rather high. but in this group, individuals suffer from anxiety or depression, 95% anxiety. But there are no other associated problems. And the third category, intellectual and language deficits. So when there are language deficits, you can think of intellectual problems, but there are problems with the senses as well. And we find those in the last four categories, especially in the last three. However, the intellectual deficit is not linked. One moment, please. Related to troubles with anxiety or the anxiety disorders. So that's very important because the only medication authorized by the FDA to treat autism is an antidepressant. 28% of the population here that in fact are not eligible because in fact we can't give that medication to this group. And there's also the gastrointestinal and anxiety disorders. The last two categories which could be in fact one category. There is hyperactivity and attention deficit. There are two groups because some who have ADHD are related to musculoskeletal disorders and other neurodevelopmental. So the last one is only 7% of the population, but these troubles, it is a neurodevelopmental disorder. The symptoms are similar and the physiology is similar from one group to the next. So maybe one characteristic within this group, but same thing for any of the groups here, because the intellectual deficit and language deficits, gastrointestinal and anxiety disorders, hypersensitivity among autistic people is often related to gastrointestinal problems, sleeping problems. So I wanted to talk about medicine, precision medicine. Yes, more and more that is being developed. In autism, it's not developed yet because we're trying to bring groups together based on the symptoms that are directly related to autism. The idea here really is not to put the emphasis on the presence of intellectual issues. Often these groups are too, in fact, we want to put the emphasis on groups that who are homogeneous regarding biology aspects. This, in fact, would provide a better context, but also a better context for diagnosis. There are many autistic adults who are not diagnosed as autistic. Why? Because it's difficult to identify symptoms, and in fact, it could be very costly to get a diagnosis like that one. It can cost up to $2,000 to get a diagnosis. And the precision medicine is very popular, but many members say it's still much more costly because we need to. There is a lot of treatment that needs to be put in place. But there's 1% of the population, in fact, 1% of children who are on the spectrum autism. This compared to 1.5% of adults. So it's the same proportion during one's life. But 16% of autistic adults who work full time. So this is approximately, and this is a very broad estimation, it's about 6,000 people here in New Brunswick who don't work. So if we find a great part of these adults who could work, well, this would compensate, in fact, the cost for interventions. So all this to say that we need to be creative and be compassionate toward others, so that the model that I presented here, which is a collaboration with the autistic adults, is a global one. So is it viral, or is it very popular to have the adults participate? Well, this still enables one to make a difference. And we can all, in fact, follow these same steps in the creation of a project, because we all want to help. We want to find viable solutions for the people we serve. And the impact of the participation of patients can be at various levels. This changed me, myself, and I won't do research the same way anymore. It can change others and help them, in fact, to open their heart to the needs of the community and not stay concentrated on themselves when we all have the same goals, even if we have different needs. So success is also to be able to change the approach of research. So put aside this status quo and try to get to know others. And that becomes contagious. So I won't be doing my research the same way anymore. Don't say that fundamental research is bad. No, not at all. But I'm saying that if I went back to the lab now, if I had an opportunity to go back to the lab now, my projects would be much more innovative, much more relevant, and would have a bigger impact on people. Yes, patients can be part of the fundamental research, just like for the establishment of various services. We can all make a big difference. In fact, if you wanted to put in place projects with the group, there is a toolbox that I share with many researchers, and I could share that with you. So I present Connect with autistic adults who are partners in the project, because I don't like talking in their name. So maybe that's why I just talked about myself. But I wanted them to be able to say a word.